Let's see the definition of obturation. It's a 3D hermetic seal of the root canal system from the coronal to the apical with an inert material that provide apical. Let's see the definition of obturation. It's a 3D hermetic seal of the root canal system from the coronal to the apical with an inert material that provide apical, lateral, and coronal seal. What's the meaning of these words? 3D hermetic seal. That means that the obturating material must seal all along the root canal from 3D aspects: labial, lingual, mesial, and distal. So, and it must be a very tight seal between the obturating material and the dentine of the roots. So, the meaning of hermetic seal is tight seal. From the coronal to the apical, from the coronal of the root canal to the apical part of the root canal, with inert material that provide apical and lateral and coronal seal. The most important thing in the obturation is the very, very good seal. If there is any spaces, let's see the good seal, like in this picture. Let's see why we are saying that 3D hermetic seal. When we see the picture in the right side, when we do a 2D X-ray, 2D, the periapical X-ray give us 2D. Look, there is a 2D X-rays from for the root canal, longitudinal view. Let's see, it is almost good, but when we make a cross section, it will be there is a spaces between the cones of the obturating material. That means that there is not a hermetic seal, there is no a tight seal, and there is spaces between the cones, so there will be leakage in these cases. So we have to make like the other picture, the X-ray must, the cataperca must seal all the parts of the root canal all over the root canal from the apical to the coronal. Let's see the definition. There is an important question. Why we are doing obturation, and when we are doing the obturation, and with what we are doing the obturation. These three questions is very, very, very important. Why we don't make root canal or cleaning and shaping and then leave the canals empty without any obturating material? Why, and when we decide to finish the cleaning and shaping and do the obturating of the obturation for this tooth, and with what is the materials we are using for root canal obturation. So now we will discuss these three questions in details. Let's see the definition. Now, after we do the access preparation, we do cleaning and shaping for the root canal. We have to do a very good flaring to permit space and to let the getaperca enter the root canal without any resistance. We have to clean the canal for an optimum size and optimum shape for receiving the obturating material. So first of all, to do a very good obturation, we have to do a very good access preparation and very good cleaning and shaping to the canal. This is a very important point. Let's see the definition. So, why we are doing obturation? This is the first important question we have to think of it. Let's see the definition. So, the first thing, to prevent micro leakage from the periapical oxidate into the root canal space. So, we prevent any micro leakage from the apical part of the tooth or from the periapical tissue to the root canal, and also to act as a barrier against coronal microleakage. So we are preventing the apical microleakage and the coronal microleakage. Third one is to create a favorable biological environment for healing. When we seal the canals, so we can permit healing for the periapical tissue. If there is a periapical radiolucency, if there is a periapical pathosis under the tooth, so when we make a very good cleaning and shaping, when we make a very good obturation with a 3D hermetic seal, so we are creating now an environment for a very good healing for the periapical tissue. So why we are doing obturation? To prevent microleakage from the apical and the coronal part of the root, and to create a very good environment for healing to the periapical tissue. Let's see the definition. The second question, when? When we decide to make the obturation, when we can say that now we have to go and finish cleaning and shaping and go to obturation. Let's see the definition. First thing, when root canals is clean and shaped to the optimal size. So we have to clean the canals to the optimal size. We cannot clean the canal to less than the optimal size according to each teeth. According to each tooth, sorry. Now, the second thing, the tooth must be asymptomatic. There is no pain, there is no discomfort, there is no pain or percussion. During eating, there is no pain. That means that the condition is suitable for obturation. Absence of foul odor, absence of oxidate in case of presence of abscess, absence of sinus tract, and intact temporary filling, which is the most important thing. Let's see for the previous mentioned titles. Now, the absence of foul odor is very important. When we clean and shape the canal, must be without any odor. The presence of oxidate, we have to make sure that there is no any oxidate or pus coming out of the canal, and the sinus tract is healed. The temporary filling is a very important factor between visits. When we put a temporary filling, we have to put very good temporary filling, because when the temporary filling falls down between the sessions, that means that there is contamination in the canals. So we will again re-clean the root canal again. So we have to use a very good temporary filling, and we make sure that the temporary filling didn't fall down between the sessions for the root canal treatment. Let's see the definition. Like this, we have to be sure that there is no any lesion. If there is a fistula like this, we have to make, and we don't know it's related to any tooth, so we have. Let's see the getaberka tracing. We put the getaberka in the fistula to point the area or related tooth we need to treat it. Let's see the definition. The third question, what or how, with what we are doing root canal obturation and how we are doing it. Let's see the definition. First thing, we have to know the materials. What is the materials we use for obturation? First thing, the core material. What's the core material? It's the main core material we put for obturation, like the getaberka, like the Rizilone, or previously we was using a silver point, but nowadays we are not, nobody is using the third silver point, and we will discuss this later. So the cataperca is the most material used now for obturating the root canal. Cements and sealers to join these catapercas together and to seal the canals, and we will discuss all these in details after. And past like chloroperca, ioperca, and iodoform pasts. Let's see the different thing, the gataperca or gatapercha. This gataperca is came, or we extracted from a tree called perja. This is a tree. We extract the gataperca from it. Let's see the difference. In the chemical nature, it is a high molecular weight polymer structure from isoprene monomers. Gataperca naturally present in two forms, the alpha form and the beta form. So it is a high molecular weight polymer. Let's see the difference. It's present in an alpha form and in a beta form. There is a difference between the alpha form and beta form. The chemical structure is the same, but it's an isomers. So when there is an isomer, it's the same chemical form, but the differs in the physiological forms. So there is an alpha form and beta form for the. Let's see the difference. When we take from the tree, we extract the cataperca in an alpha form. When we heat this alpha form, it goes to an amorphous alpha form, and then we make cooling for this cataperca. It gives us beta form. When we do the opposite direction, we return again to the alpha form for cataperca. Let's see the difference and beta form. Alpha form is better viscosity, tackiness, that means it's sticky, less shrinkage. But beta form, it is more stable and more hard, and there is no thickness in it. So the gataperca which we use now in the market is in a beta form. When we take this beta form and heat it, it becomes alpha form. Let's see the difference. So the physical properties or the physical nature for the gataperca is like this picture. It's like an tapered cones with different sizes. The gataperca expands slightly on heating, therefore we have to condense it after we heat it to compensate the cooling shrinkage. And the gataperca get brittle by aging. When we take an expired gataperca and we try to bend it, it will fracture suddenly. It will not bend. But the new gataperca, it will bend with you and will not be brittle. Let's see the definition of gataperca. When we see that, when we call it gataperca, we will say, or we will think that the most important composition in it is gataperca. No, it's 20% only gataperca. The main percent is zinc oxide eugenol, and there is 15% metal sulfate and 5% wax and resins. Let's see the definition. The gataperca present in standard cones standard cones, like the ISO standardization of the files. There is two types. There is assorted and non-assorted. In this picture, this is assorted from 15 to 40 sizes. It's the same or like the sizes of the files. This is the standardized cone. The gutta perca present in 15 till 140 sizes. The same. Let's see the difference. It has the same ISO standardization for the files, and this is the non-assorted. Sometimes we will find assorted packs like this one, and sometimes we will find non-assorted. All the pack has just one size. Let's see the difference. There is non-standardized cone like which we use in the rotary files. There is like the F1, F2, F3 like we use in the Pro Taper rotary files. There is the M like medium, medium fine, fine, medium fine, fine, fine. This also, it's non-standardized obturating or gutta perca, and there is another standardization like the different taper like 4%, 6%, 8%, 10% gutta perca for the rotary files. Let's see the difference. Also in the market available a pellet form. These are pellets. We put these pellets in the gun and then we heat these pellets and injected in the root canal. This kind of gutta perca, when it's like a pellet, it's in beta form. When we heat it and goes out of the machine to the root canal, it will be in alpha form. Like we say previously that the alpha form is more tackiness or sticky, and let's see the difference, not hard like the beta form. The fourth one is the heatable syringe. This is a heatable syringe. The gutta perca is in the cartilage and we heat the cartilage and put it in syringe and inject it. Let's see the difference. We can disinfect the gutta perca cones by 5.25% of sodium hypochlorite for 1 minute. Let's see the different advantages. What's the advantages? It's compatible and adaptable. Compatible, adaptable means that it can be adapted to the wall of the root canal and can adapt to the irregular contour of or if there is a curved canal, it can go and bend to enter the curved root canals. But if there is a very good cleaning and shaping and very good space, can be softened like we said before. We can soften the gutta perca by heat or chemical. We talked about the heat previously and then we will talk about the chemical part of softening later. Inert material, it doesn't cause any periapical lesion or any irritation to the periapical tissue. Dimensionally stable. Yes, there is a slightly shrinkage in the gutta perca, but it's almost acceptable for the shrinkage in it is much more acceptable. Radio opaque, so it must be radio opaque to see it in the periapical x-ray. Can be easily removed. It's an important part. It can be easily removed because if we need to retreat this tooth or as there is any mistake in the obturating technique or the root canal, so we can easily remove it and make retreatment again for this tooth. Let's see the disadvantages. Lacks of rigidity. It's not rigid. If we didn't make a very good cleaning and shaping and create a space for the gutta perca, it will not enter the root canal and it will bend. So it's lack of rigidity, so it can be bent. Lacks of adhesive quality, does not adhere to canal wall. We need a sealer to let it adhere to the canal wall. Can be easily destroyed if it is stretched. So because it is a bendable material, so it can be easily destroyed. Let's see the difference. There is a new formulation of gataperca in the market. It's an mitigated gataperca. We put a iodoform in the gataperca, so it become a medicated gataperca to inhibit the bacterial growth. And also there is a calcium hydroxide gataperca, cones containing 40 to 60% of calcium hydroxide to permit simple placement of medicament between appointments and to permit healing for the periapical tissue. Let's see the different thing. Our material we use for obturation is Resilon. The first material was, which we talked about, is gataperca, and the second one is. Let's see the difference. It's a thermoplastic synthetic polymer based root canal filling, contains bioactive glass and radio-opaque fillers in a soft resin matrix. It's like an gataperca, but it's an bioactive glass with synthetic polymer. The gataperca was a natural polymer we extracted from a tree, but the Resilon is a synthetic polymer containing bioactive glass and radio-opaque fillers. This is the picture for Resilon. It's like a system. It has the same concept like the etch and bond technique in the composite restoration. It is it's like a resin matrix. There is a sealer for it and the cones, and we make etch and bond to the root canal. It's biocompatible, non-toxic, non-mutagenic. It's strengthening. But the most uh, disadvantage for the Resilon is the retreatment. It's very hard in retreatment. The chemical names of the Resilon is Real Seal and Epiphany. Let's see the difference. Make a scan electron microscope photo to compare between the Resilon and gataperca. Here in the left view, we see that there is no any gaps. There is a root canal, very good root canal sealers, sealing. There is tags like the which we make in the composite, and it's a very good. Makes a very good sealing, very good tight seal. In the other picture, no, there is a spaces between the obturating material and the root dentine. So in the sealing, yes, the Resilon has the superior sealing properties, but it's very bad in retreatment. It's very hard in retreatment. Let's see the difference. The third thing is the silver cone. Silver cone was used previously, all days ago. Let's see the difference. Its composition is 99 silver and then traces of nickel and copper. Its properties, it is hard. It's like needles. The same like a needle, and we can put it in the root canal. It will not bend. It's not flexible, so we can put it in the root canal. But it's they were using it like a single cone, which nowadays is a very bad technique for this kind of techniques, silver cone, single cone. High resistant to tensile strength. Oligodynamic has a oligodynamic property and corrosion. Let's see the definition. 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 Let's see the definition.